Hello everyone, welcome back. I am Dr. Alexandra. In this week's video, we're going over acne. Particularly, we're going to be talking about hormonal acne, which is a big topic. Given kind of what I do for my practice, right? I see a lot of acne, and it's something that I do see kind of not super duper well treated. I think that people like to take one approach or the other, right? So they're doing all the dietary things, all the nutritional support and all those kind of things, but not necessarily taking the topical approach, or just topical and none of the inside. And I feel like we need to balance those two out. That's how you get the best results. So today we're going to be going over those things. We're going to be talking about kind of what hormonal considerations we think of in acne, what topicals we think of, and how do we go about kind of treating this, and where do we start? So before we dive into our video, which has a lot of good content today, if you like the content that we're putting out, please go ahead and hit the like button. Every single time you do that, it helps us just get our videos out there to more people, and that's our goal, get our videos out there to more women and help them. So if you want to hit the like button, make sure to hit the subscribe button if you aren't subscribed to the channel, and drop us a comment below. All of those things really help us out, and we really, really appreciate it. All right, so without further ado, acne. So when we're thinking about acne, we need to think of a few things, right? So first of all, we're thinking about clogged pores. So that follicular hyperproliferation, clogging up the pores, and leaving us more vulnerable to acne, right? Then we're thinking about sebum production. So how much oil is our body producing? How much oil is our skin producing? We're thinking about acne bacteria, so P. acne bacteria. A lot of people think of bacteria as being first on the list, but it's not really actually first on the list. There's a lot of considerations to think about when it comes to acne, and particularly what's causing your pores to be clogged. And then inflammation, and actually I probably should have put inflammation a little bit earlier on that list. We know that inflammation plays a huge role in acne, and particularly that hormonal acne that tends to be a little bit more cystic. So how do we know if we're having a hormonal acne? Well, it becomes a little bit harder to tell. Oftentimes when it comes to like lab results and things like that, which we are going to talk about, maybe labs that we might want to consider running, but when it comes to lab results, sometimes with acne, they're not really showing up, and we're going to talk about why. So usually we talk about hormonal acne when we think about kind of lower face acne, right? So like jawline, chin, cystic, and painful. What do I mean by cystic? So they're usually not coming to a head, right? They're deeper. They're not going to be a white head or a black head. And they usually come with a lot of inflammation. And that's because that deep acne has been kind of building up for a longer period of time. So they tend to be slower to get rid of. They tend to be a lot more painful to the touch. And they tend to not have that like white head component to it. We're thinking about hormonal considerations, right? Our brain first goes to testosterone. And testosterone, it's a good place to start. It plays a big role in the way that our skin creates sebum, and in some of those factors that are clogging up the pores and causing us to get acne. What's interesting is, like I said earlier, sometimes on labs it doesn't really show up, and there are a lot of reasons for that, right? So oftentimes you can have patients, if you think about polycystic ovary syndrome patients, right? So if we take like a step back from acne and we kind of go to polycystic ovary syndrome patients, oftentimes in polycystic ovary syndrome patients, we can have signs of hirsutism, which is basically a nice fancy word for signs of too much testosterone or too much androgens, but not necessarily have them show up on labs. And we wonder why, right? So the way we create androgens in the body is there's actually in the female body, right? Part of our androgens are created by the adrenal glands, and then part of our androgens are created by our ovaries. And that's why DHEA, right? If you're taking DHEA as a supplement, sometimes DHEA, if you're taking too much, can be a big contributor to acne because it is an androgenic hormone. The other thing that we need to look at with testosterone is how are we metabolizing out our testosterone? There's some really interesting research on the fact that symptoms related to especially elevated androgens, right? So symptoms related to having too much testosterone actually have more to do with the metabolites of testosterone than testosterone itself. So what do I mean by this? So basically, right, you can go down a 5-beta way of metabolizing our testosterone, or 5-alpha, so 5-alpha reductase. 5-alpha reductase actually turns our testosterone into DHT, which can be like 5 to 10 times stronger in terms of symptom management. What that means is that if you can have completely normal levels of testosterone, but if you're converting a lot of that down the 5-alpha pathway and creating more DHT, you're gonna have more signs of high androgens. So that's why labs don't always show this, right? And if we're thinking about testosterone, the way that we're metabolizing out testosterone and we're really having symptoms of high androgens and not getting any results or any answers. That's why doing things like a Dutch test, which at some point I'm going to talk about on this channel, but dried urine hormone testing can be really, really helpful, because that allows us to really hone in on those metabolites, right? Hone in on which pathway are we taking? Are we going down the 5-alpha reductase pathway more, leading to more signs of high androgens and more of those symptomatic presentations, but not necessarily with high testosterone if we were just to pull a blood sample. The other thing I always tell my patients is that with testosterone specifically, we really don't, we have values for testosterone in women, yes, but I feel like testosterone is one of those hormones where women really function differently, right? And every person has a different kind of threshold, and I think a different level of where their testosterone would have been when they were like in their peak, right? If we drew it at like 20 or whatever. So I think it's really about kind of marrying that picture, and oftentimes those metabolites is really what's missed. So that's kind of the first hormone we think about, right? So next we go into progesterone. What's interesting about progesterone is that normal levels of progesterone can actually help inhibit 5-alpha reductase, which means if you have normal levels of progesterone, you're going to be hopefully less likely, we'll talk about other things that contribute to this as well, but less likely to be going down that 5-alpha reductase pathway, less likely to be creating dihydrotestosterone, and less likely to be getting those severe androgen symptoms. There is a little bit of thought on hormonal acne in like the second half of your cycle having to do with rises in body temperature from progesterone. So as progesterone rises after we ovulate, right, sometimes you can have a transient like little rise in body temperature, an increase in sweating, an increase in sebum. But really when it comes down to it, if you're ovulating normally, that can actually be really, really helpful for balancing out those high androgenic symptoms. So that's helpful. So the next thing we think about is estrogen. A lot of people think, oh, estrogen, right? I'm having hormonal acne, so my estrogen must be high. Oftentimes it's not actually the case, right? With higher levels of estrogen, we know that higher levels of estrogen will have a negative feedback loop on your gonads, so on the way that you create sex hormones. The other thing is that with higher levels of estrogen, we tend to create more sex hormone binding globulin. We've done lots of videos on sex hormone binding globulin in the past, right? It's one of our favorite topics because I think it's something that women do not understand. And it's really, really important to understand in terms of symptom management. But sex hormone binding globulin is definitely that balance, right? Like, we don't want it to be too low, but we don't want it to be too high. And when we're thinking about acne, right, having a little bit of sex hormone binding globulin, a small raise in sex hormone binding globulin from estrogen, because estrogen will also be carried by sex hormone binding globulin, can make it so that we have less androgenic symptoms, right? Less free testosterone. So the sex hormone binding globulin will bind up that testosterone, put it, so to speak, into storage, and then we end up with less androgenic symptoms. So that can actually be really helpful. So oftentimes we think about estrogen, estrogen and progesterone, having normal estrogen and progesterone in our cycle, like healthy levels of estrogen and progesterone can actually be really helpful in terms of acne. The next thing we think about is insulin and insulin-like growth factor 1. Insulin is one of the ways when we think about insulin is why sugar gets talked about when we think about acne, and it's why we talk about avoiding like high glycemic foods, right? So with insulin, higher levels of insulin tend to decrease sex hormone binding globulin levels, okay? So meaning that we have more free testosterone running around, more androgenic symptoms, and insulin actually encourages that 5-alpha reductase pathway. So we're more likely to go down that 5-alpha reductase pathway if our insulin levels are high. So again, leading to more of those androgenic symptoms. Insulin really does change kind of the way that we modulate, I think, this symptom management from testosterone in the body, okay? The next thing we think about is insulin-like growth factor 1, or IGF-1. And IGF-1 is a growth factor, right? So it's really different than insulin. When we think about IGF-1, we're thinking about this in terms of acne because IGF-1 plays a huge role in inflammation in the skin. It plays a big role in sebum production in the skin, and it definitely makes acne lesions worse. So this is why we think about dairy, avoiding dairy, and that being helpful for acne lesions. Specifically, interestingly enough, research shows that the dairy that is the biggest culprit for raising IGF-1 levels is going to be skim milk and ice cream. So those are kind of where I get my patients to start, but honestly, if you're having cystic acne, removing dairy from your diet entirely and testing that out for a long enough period of time to actually see if it gives results can be really, really helpful, because we know IGF-1 plays a huge role in the skin. And so that's something to consider. The next things that we want to consider would be glucocorticoids. So sometimes steroid use, even like steroid dose packs, things like that we use for medications, can actually cause a little bit of an increase in inflammation and increase in acne. And then prolactin. So prolactin, right, if we're having abnormal cycles as a female, right, prolactin should be like our #1 first stop on our testing journey. And we know that prolactin really changes our hormonal picture, and it can play a role in acne. So checking prolactin, even though it's not the first thing that comes to mind, can be really, really important. And then finally, right, we want to talk about cortisol and we want to talk about thyroid. So cortisol specifically, under higher levels of stress, we know that we increase our sebum production. The body naturally increases its sebum production, right, because its job is to protect you. It's trying to figure out how to do that. And so increasing sebum and protecting your skin as being kind of your first barrier of defense is really important. And it thickens sebum production. So it doesn't only increase it, it also thickens it. And so higher levels of cortisol can play a huge role in acne. And that's oftentimes why patients will find that their acne is worse with stress, especially if they have a hormonal acne, right? So let's say it shows up at a certain point in their cycle, and it tends to have that very like monthly component to it, right? And then we add stress on there, it's going to be way, way worse. So that is definitely a consideration. The last consideration I would make is thyroid. And I would make thyroid as a hormonal consideration in acne because we do know that thyroid plays a huge role in the skin, right? We know that with hypothyroidism, you're more likely to get super dry, itchy, flaky skin. And it does change the way that skin cell turnover happens. So thyroid is something I would consider. Probably not the highest in my list of differentials for hormonal acne, but definitely a consideration that we might want to think about. So now that we've kind of talked about some of the hormonal components, you'll see that a lot of the hormonal components have those key components to it, right? So they have this idea of increasing sebum production, clogging the pores, and increasing inflammation in the skin. And when we think about treatments for acne, that's really where we want to go down. We want to go down that path, right? So going through some of the things that I would consider in terms of topical ingredients to look for. The first thing I really like to use is acids, right? So salicylic acid is a beta hydroxy acid. It dives deep down into the pores, it clears them out, and it's really a first line of defense for acne. I prefer to mix these with a little bit of alpha hydroxy acid. So usually like a good glycolic or a lactic acid or a mixture of both. So one of my favorite products is actually a salicylic acid, glycolic acid, lactic acid mix. What I like about that is that alpha hydroxy acids, right, are going to work on the surface of their skin. So they're really good at helping to break apart those skin cells and kind of get rid of the glue between the skin cells so you're able to normally slough them off, right? We know that one of the things that happens in acne is that we tend to get those keratin plugs into the pores, and so we're not able to properly slough off our skin. So that is a consideration. What I like about lactic acid too is that lactic acid does have can be helpful in hyperpigmentation, and we know that with the inflammatory component that happens with acne, we can sometimes get that post-inflammatory hyperpigmentation, which is sometimes why we scar. So lactic acid can be helpful for that, and then glycolic acid can also be kind of helpful for that. We think about that a little bit less so. So those are my considerations with acids. I like a mixture of acids, and I really like getting in some salicylic acid into a treatment protocol. Other things that you usually would think about, right? So benzoyl peroxide is something that is recommended a lot. I'm not a huge fan of benzoyl peroxide. So for me, I think that I see a lot of acne patients who tend to really overtreat their skin. We know that if we overtreat and overdry our skin, what happens is your body will compensate by making more sebum, right? It's gonna protect you, which is usually why we see acne patients that are so oily by the middle of the day. It's usually because they're overdrying their skin, they're not adding any hydration in there. Other considerations of things that we would think about with treating acne. Retinol is our first line of defense, right? Retinol is a great evening addition, right? Some patients do not tolerate retinol well if their skin is super sensitive, and working our way up to that can be really, really important. But retinol is one of the best ingredients for helping with skin cell turnover. And so being able to help with unclogging those pores and getting things moving in the right direction for acne can be really, really helpful. Azelaic acid is another interesting first line of defense kind of treatment. So with azelaic acid does dive into the pores and help clear them out, right? Like we talked about with salicylic acid. It's actually been shown to help kill the P. acnes bacteria. This is the first thing we're really talking about where we're talking about killing that bacteria. That really hasn't been the focus of most of our conversation. But azelaic acid does do that. So there's some interesting research that shows that it helps to create more of an environment that's like less productive to the P. acnes bacteria. And it's also really, really, really anti-inflammatory, which is going to lead us into a whole other host of other ingredients that we would think about, because cutting that inflammation in the skin and really helping with that is really, really important, especially if we're having cystic acne. Usually for me with my cystic acne patients, I will do acids or retinol, or I'll do a combination. So like a trade-off one night for the other. A really good cleanser, because a good cleanser is highly necessary. And then I do an anti-inflammatory product, and my favorite anti-inflammatory product is actually by IS Clinical, and it's a product called ProHeal. I've definitely mentioned it in other videos before. It's actually a vitamin C, vitamin A based mixture with like olive leaf extract, and it is the most anti-inflammatory product that I've used in my patient's skin. I mean, I use it in my patient's skin with rosacea, I use it with cystic acne, I use it with kind of any really inflamed red condition, and it really works fantastic. And it's not irritating, which is great. So anti-inflammatory products can be really helpful, and azelaic acid, which is kind of what got us down this rabbit hole, is one of the things that's also anti-inflammatory, and it is considered kind of a first line of defense. To get the strength that you need for azelaic acid, you may need to go with prescription strength, right? There are over-the-counter azelaic acids, but they may not be strong enough to actually do what you're expecting them to do. Other things you might want to consider would be products that have nicotinamide in it. So that ingredient is actually really interesting. It's very anti-inflammatory. It helps to reduce sebum levels, and it helps with hyperpigmentation. So again, when we're thinking about the trifecta of what's happening with acne, right? That inflammation, the sebum, as well as that post-inflammatory hyperpigmentation, which can lead us to have scarring. This ingredient can be a fantastic addition. Oftentimes I really like this in a product that has a little bit of hyaluronic acid in it. So you'll usually see it with a little bit of hyaluronic acid sometimes. And I think hyaluronic acid is an amazing addition for acne patients. The majority of acne patients are really hesitant to put anything oily on their skin, right? And they're really hesitant to use any thick moisturizers or heavier creams because their skin just really doesn't tolerate that very well, right? So hyaluronic acid can be a really good way to get in a little hydration. And if it's mixed with something like that nicotinamide, that can be really, really helpful. And then on top of that, right, we're getting in a little bit of hydration, but we're not adding in oils to the skin. Other considerations would be an oil-free ceramide moisturizer. So we've talked a lot in the past about ceramides in the skin, which are really, really important. And in acne, you just probably are going to want to go with an oil-free moisturizer. That's going to be really, really important. Then we need to move on to some other treatments that we think about. So treatments that we think about for hormonal acne would be medication-based, would be birth control pills. What we really want to do is a combination oral birth control. So with this, right, we know that progestin only, including progestin only IUDs, can actually lower sex hormone binding globulin a little bit and raise levels of free testosterone, which can make acne worse. And that is one of the complaints that people have about progestin only IUDs, is that sometimes they can make acne worse. On the flip side, right, we've talked about the negatives of this, but sometimes there are positives of this as well. With oral birth control and specifically oral estrogen, we know that that's going to raise sex hormone binding globulin levels. We know that it decreases total and free testosterone, and so can make that androgenic picture way, way better in terms of acne. So that is a consideration. Next consideration, which would be an androgenic medication, would be spironolactone. Spironolactone is a great medication for hormonal acne, and it's definitely a consideration if you need a little bit stronger of that androgen blocking capabilities. And then finally, isotretinoin, right? So we know that like Accutane can be a really, really good way to decrease cystic acne. It does work really well. It has a lot of side effects, and it is a very, very, very tightly controlled medication. But in terms of efficacy, especially if you've kind of failed some of the other acne treatments, it is a consideration. And then we want to go to nutrients. So we talked a little bit about diet, right? So with diet, it's really going to be avoiding dairy as much as possible so that we're not getting as much of that IGF-1 spike, avoiding high glycemic foods that are going to raise your insulin response. And then, so avoiding things like processed sugar, and then making sure that we're getting in good micronutrients. So micronutrients are really, really important for the skin. When we're thinking about this, we're thinking about things like zinc. So zinc's really important. Omega fatty acids are really important. So we've talked about this a little bit before, right? But our skin barrier is made up of a lot of fatty acids, ceramides, fatty acids. And so getting in good omega-3 fatty acids can be really important. On top of that, that's one of the more anti-inflammatory, if not most anti-inflammatory kind of supplements that we can take. So that can be really, really helpful for the skin. Vitamin D, so there's some really interesting research in like vitamin D and PCOS and the skin. So vitamin D, also a really helpful nutrient. And then thinking about your B vitamins. So particularly B12 and B6 actually can both make acne worse. So if you are high in those things, right, and you are having acne flares, or you're getting things like B12 injections weekly and you're having acne flares, that could be a consideration that you might want to consider. Oftentimes I have seen that's not usually the cure for acne, right? But sometimes it is a contributing factor in that moment as to why it's a little bit worse than maybe it was before. So when we're putting this all together, right, I think when it comes to treating a hormonal acne picture, if you're gonna really do a good job of putting this together, where I would start is I would always start with tuning up the skincare and making sure that people are on a really, really good regimen. That's what's really going to make the biggest difference in your skin long term. And honestly, the number one reason why people stop using their products is because they don't work or they're too expensive. And I think if that's you, then getting a good consultation, getting on some really key products for your skin is going to be where you get the most benefit long term. Other considerations, right, would be some of the dietary component piece that we can make changes in to see if it helps. And I have done that in teenage patients. They do not like me when I do that, right? They do not like me when I take dairy away from them, or when I encourage them to remove dairy, I guess I should say. But I've had so many patients that now will say, oh, well, yeah, my acne's worse this week because my mom decided to make lasagna, and I know, right? So things like that can be really helpful. And then potentially getting a good hormonal test run. So running things like free and total testosterone, running sex hormone binding globulin. If you're not on an oral birth control pill, running estrogen and progesterone on the proper days of your cycle, right? Because we can't just run those any day. Running insulin levels, considering running a prolactin and cortisol. And if you're really experiencing symptoms of high androgens and not getting any answers, running a Dutch test. And one day we'll jump on and we'll talk about that, but running a dried urine test and running those testosterone metabolites and really talking about, are you going down the 5-alpha reductase pathway, and maybe is there a bigger hormonal consideration that we need to be thinking about? Those are kind of my acne tidbits. I feel like that was a lot, but those are my acne tidbits. So I want to hear from you. What has worked the most for you for your acne? And what are your can't live without products? Put them in the comments below, and we'll see you next week for next week's video.